Hey guys, it's Judy from Nutrition with Judy. Okay guys, I hope you've been having a good week. I hope you guys have been taking care of yourselves. So this week I am really excited. I had a conversation with Dr. Stephen Hussey and we talked about everything that's related to heart health. He just came out with a book not too long ago called Understanding the Heart: Uncommon Insights into Our Most Commonly Diseased Organ. So heart disease is the number one killer now in our modern world. And we just talk about what causes heart disease, what are some of the toxins, and what we can really do about heart health. We talk through some of the ways that we can have good heart health, but then we also talk about how it's really more than just diet and how stress and other things are so important in managing, because it actually can affect the heart. So yes, somebody that is a meat-based person can actually have a heart attack, or can that eats keto or that removes carbohydrates. So it's really important to manage diet, but there are other areas that we also need to talk about. In his book, at the end, he wrote an afterword and he shared with me kind of what happened. But this is a very powerful book. You guys want to check it out, especially before, if it gets published and it's kind of off the market for a little bit, you want to check it out, because this book has so many tips and it kind of wakens you up as to what can cause heart disease and what we may need to be doing in our lives other than diet that we may need to change to really have good heart health. Dr. Stephen Hussey is such a genuine individual. He's really out here to help people, and I hope that you guys can see it in our conversation. And I really was able to see it offline with him. So I hope you guys learn a thing or two about heart health and just manage stress and just take care of yourselves. So let's get right into this. Hey guys, it's Judy from Nutrition with Judy, and I am very excited. Today I have with me Dr. Hussey. He just wrote a book and we are going to talk about all things related to the heart. So Dr. Hussey, thank you for joining me today. If you could tell a little bit about yourself to the people that are listening and watching.
So I'm by trade, I guess, chiropractor and functional medicine practitioner. But I'm really just interested in health from any aspect. I don't need necessarily like an ideology or a type of medicine to look at. I just am interested in health. And that's mainly because of my own health journey. Because when I was a kid, I had a lot of what we would call inflammatory health conditions, from chronic hives to asthma to allergies to IBS, all kinds of stuff. And ultimately ended up with autoimmune type 1 diabetes from that inflammation, which is where my body kind of got confused and attacked a certain tissue in my body, the pancreas, and now I don't make insulin. And so that kind of, threw me into Western medicine. My parents and I were reliant on that to help manage these conditions. But it wasn't until college when I started figuring out that, the way I live my life, like what I ate and managed stress and that kind of stuff, had a direct impact on how well I can manage these conditions. And so I got rid of all those inflammatory conditions that I had by changing my lifestyle, except for type 1 diabetes, because it's kind of collateral damage from what happened. And so, yeah, since I'm type 1 diabetic, I've been told my whole life that I'm predisposed to heart disease. And so every time I learned anything about it or heard anything about it, my ears perked up, and I've just accumulated a lot of information, and I started sharing it, and people seem to like it. So I decided to write a book, and here we are.
That's amazing. I'm so interested. I've never actually had an interview with the type 1 diabetic. I know that there are some type 1 diabetics in the keto carnivore community. So, what diet were you recommended? And then what did you kind of fall on to actually reduce a lot of the inflammation?
Yeah. So originally I was told to eat whatever I wanted, and just,
Oh, wow.
if, depending on what I ate, to give more insulin if I needed it. So I remember I was given a little booklet that basically showed me the amount of carbohydrates in every single fast food that was available, every single fast food restaurant there was. So it was like, it's okay to go to these fast food restaurants, just make sure you give yourself insulin for it, was basically the message I was getting.
Wow.
And yeah, so kind of crazy when I look back on it now. And so then, yeah, I mean, I started figuring out that, if I changed my diet, maybe less carbohydrates or just more whole foods, it was easier to manage things. and it was definitely a trial and error process. Like when I first got started, I had no idea what I was doing really. And so, yeah, over time, it ended up being more like of a paleo diet. And then it evolved more into like low carb, which became really easy to control blood sugars, based on everything I had experienced before. And then, recently, I'd say the past, well, about 6 months ago was the end of when I did like a carnivore diet. And I did that for about 2 years. And I saw definite changes in my health that I'd never seen with any other diet before with that. And I'm now back eating some plants, but still very animal based, because that seems to work best for me. And, my inflammation is very low. Blood sugars are very easy to control, even though I still need insulin with that type of diet. It's just, they're still much easier to control, and I use way less insulin. So yeah, that's kind of what I settled down, and it's really working for me.
Wow, that's amazing. There's a lot of chatter in the community that there's this thought where basically we need insulin to get then, so we shouldn't have too low of insulin because that will affect cells getting some of the, sugars or some of the stuff that needs to kind of happen for hormonal health, thyroid, for even our heart health. So, what do you say to that? I mean, do we need carbs for insulin to kind of normalize and it not be too low so that we can actually properly function?
Um, I would say no, just based on the very fact that myself, like when I have a no carbohydrate diet, absolutely zero carbohydrates, I still need to give myself insulin. It's not in the same amounts, and it's definitely not. I have to time it differently because carbohydrates will spike things sooner rather than proteins will do it later. But I still need insulin, so that just tells me that even someone who's not type 1 diabetic, if you're eating no carbohydrates, your body is still secreting insulin to help regulate blood sugar. So that's going to act as like that signaling molecule that you need. But people, they know that insulin is responsible for, taking glucose and putting it into a cell, but it actually has lots of different functions. It signals the immune system, signals for thyroid, all kinds of stuff. But even before, or I guess maybe at the same time it does that kind of stuff, it doesn't, like if blood sugar starts to go up, insulin, when it's secreted at the local level of the pancreas, it tells glucagon to shut down, which stops the body from, potentially making or mobilizing things that can become glucose. And so then when it gets to the level of the liver, it tells the liver to stop making glucose from those things that were broken down. And then when it gets to the tissues, it tells the tissues to stop breaking down like fats and proteins and things that would eventually become glucose. And so it's not necessarily always just taking glucose out of the bloodstream and into the cell. It's stopping this whole process of making more glucose. And then if at that point, if it's not enough to make blood sugar normal, then it takes the glucose and puts it into cells. So it's kind of got this stepwise process. And so that kind of stuff could be happening, even if blood sugar doesn't go up, all that stuff's happening in the background to keep it from not going up. And then, if it's still up, then the insulin will take care of it. But so insulin's a very kind of complex hormone, and it's more than just taking that sugar out of the bloodstream.
Yeah, it's funny because I'm relatively new to the nutrition space. I mean, I've definitely been in it for several years now, but I find that people grasp onto certain technical facts in a nutrition without like explaining all the kind of, like the complexities you just talked about. And then the one fact is technically true, and then that's what people hold on to, then say, therefore you need sugar, or therefore you need carbs, or therefore you need to do X, Y, Z. And it's really interesting because the layman will then see that and say, oh my gosh, right, I need to do this and this based on this factual statement.
Right.
So thank you for explaining. I think it's a lot more complex than that. And I don't think the answer is always just you need to eat carbs to regulate everything else, because I always say a paleo diet is close to what we eat in the ideal kind of adding vegetables and fruits. And there are still a lot of people that have thyroid issues and hormone issues on that diet. So I don't think it's just that we're missing plants. I think it's a lot more than that.
Definitely.
So you mentioned that you were, when you were diagnosed with type 1 diabetes, then you were basically said there is a risk of heart disease. So what is that, right? So for the people listening and watching, why is that if you're diabetic, the comorbidity is often, or, with heart disease, the comorbidity is oftentimes diabetes? Like, why does that happen?
Yeah. So, I was curious about this as well when I would go into doctor's offices as a kid, and I'd see all the posters on the wall that said, you have 2 to 4 times increased risk, and you could go, blind, you could, get your feet amputated, all this kind of stuff. And I was just like, well, what is that? So like every doctor I went to, I'd always ask them, and they said it was because of damage to the cardiovascular system, or damage to the vessels, the arteries, especially the small ones, the capillaries. And so I was like, okay, well, how do I prevent that? And, over time I learned that, with higher blood sugars over time, which no matter how hard I try, my blood sugars will never be as normal as someone who's not type 1, and is an insulin sensitive, normal person, I would say. And so, the increased risk for me, especially if it's uncontrolled, is that there'll be extra damage done by having too much glucose in the blood. And that damage, it starts damaging the red blood cells first. And that's why we can tell from a hemoglobin A1C how high someone's blood sugar has been over the last 3-4 months or so, because the amount of damage done to red blood cells will show up, and we can count the percentage, and that gives you your A1C. But that damage it's not just confined to the red blood cells. You can get things can get overly saturated with glucose, lots of tissues in the body. So specifically the arteries. But this brings us to a topic though that I think is very important for discussing heart disease, because lots of times it's very focused on cholesterol and LDL, and everybody says that that's the thing that causes damage to the arteries and creates atherosclerosis. However, I think that is completely not true, and that there has to be some sort of prerequisite to that for the body to deposit cholesterol in an artery. And that prerequisite is inflammation, damage to the lining of an artery. It's oxidative stress that can contribute to that damage to the lining of an artery. And having higher blood sugars over time for long periods of time is one of those things that can cause that inflammation and oxidative stress. But there are many things that can do that, like endotoxemia, stress, toxin exposure, all kinds of things that people don't usually talk about when it comes specifically to heart disease that really need to be, the attention needs to be drawn to. And so, having higher blood sugars and me being type 1 is just one of those things that can contribute to that. And that's why, especially in the micro vessels, the capillaries, we can get damaged and then have issues from that.
So if someone were to be a non-diabetic, balance their blood sugars, but then have issues from endotoxemia, those toxins, are you saying that they could still have heart disease?
Oh, definitely. Yeah.
Do you want to, what is endotoxemia? Can you talk about a little bit about these toxins? Like, what does that mean?
Yeah, exactly. So yeah, like I said, there's multiple things that can contribute to the state of oxidative stress or inflammation in our body. Endotoxemia is the presence of what we call gram-negative bacteria in the bloodstream, which really shouldn't be there, especially in high amounts. And this usually comes from, and these things act like, they kind of act like free radicals. So they just cause damage to tissue. They steal electrons, which has this chain reaction that causes this damage. That usually comes from two main sources. Well, it's kind of the same source, but I consider it two, because it's all the digestive tract. And if you consider the mouth part of the digestive tract, which it is, then the health of the mouth, or our dental health, is one area that these endotoxins can come from. Because if our mouth is unhealthy, and we have poor gum health, like gingivitis and things, or we have lots of root canals, or we've had teeth pulled that weren't cleaned out properly, that can lead to this gram-negative bacteria that can drain into the tissues and then the bloodstream. But the other more popular one, it's also part of the GI system, is the gut, and having a healthy gut. Because if you have leaky gut, then those bacteria that are supposed to be in the gut and stay in the gut can leak into the bloodstream, and we get the LPS, the lipopolysaccharide, endotoxins in there. And so those are the two main sources that where we get endotoxins from. So yes, the health of the mouth is very relevant to the health of the arteries and whether or not we're going to get heart disease. So yeah, but that's one of them. And then there's probably countless amounts of synthetic toxins in our environment, man-made toxins that have only been around for maybe a half century or so, something like that, that our bodies just aren't used to, that can contribute to our oxidative stress, heavy metals, things like that, which also has to do with dental health because that's mercury and things like that. But then even, just our psychological state, our stress, there are plenty of studies suggesting that just how stressed you are can contribute to damage to the lining of the arteries because it increases that amount of oxidative stress. It puts your body in this heightened inflammatory state. And, given the, I would say, unnatural stresses of our modern day world, those things are hard to avoid, and we have to work hard to mitigate the damage from those. But yeah, those are just, some of the main ones that can contribute to that oxidative stress that damages the arteries and then causes the body to react by depositing cholesterol and minerals and things like that to heal it pretty much.
Yeah. And that's sort of how I've been trained too about what causes heart disease is, cholesterol is just kind of dropping off and, being dropped off and supporting the area because there's oxidative stress. So, what is it that causes the oxidative stress? So, your teeth, your guts, obviously it's probably some of the foods that we're eating that are causing some of that bacteria, but what is it specifically about the food and even about stress that will cause the inflammation? Like what is kind of the science, but not getting too sciencey?
Yeah. So with diet specifically, if we're eating foods that either are prone to damage or inflammation when we eat them, like vegetable oils, very unstable, very easily oxidized foods. Those can contribute to that oxidative stress and inflammation. And then if we're eating a lot of processed carbohydrates, burning through a lot of those carbohydrates, studies have shown that, using carbohydrates primarily as a fuel source in the cell leads to more free radical production or more oxidative stress production when we eat those foods. And so, so what's happening is when we get oxidative stress, it's because our body has an excess of what are called free radicals. And free radicals are, I compare them to like the Looney Tunes Tasmanian devil. So they're going around, they're going to do what they're going to do, and they're going to cause damage in the path of it because they have, these molecules like to be paired with electrons, and these are unpaired. And so they don't like that. They're very unstable when they're that way. And so they go around searching for this electron and they steal it from anywhere they can. Now, typically, we're supposed to have antioxidants available around, mostly endogenous antioxidants like glutathione and superoxide dismutase that take care of those. However, if we're doing things that cause this excess of free radicals, we can't make enough antioxidants to take care of that, and we can get this state of what's called oxidative stress. Now, free radicals are not all bad. They act as signaling molecules. There's a reason for them to be there. They signal a lot of different things within our biochemistry that can signal satiety or non-satiety or the fat cells to be certain ways, insulin sensitive or insulin resistant. So they're important, but if we get too many of them, they can cause a lot of issues. And so those are ones that the body can make itself. But then there's also the ones that we get from environment, like potentially like the endotoxins and then the synthetic chemicals and things that we're exposed to these days. Like those things can also contribute. So you can get this kind of storm that happens and then contributes to this oxidative stress that is a huge predictor of whether or not we're going to get disease of any sort, but especially heart disease.
Okay. No, that makes a lot more sense. Let's move on to saturated fat. So, a lot of the historical, maybe it started when Eisenhower got a heart attack and then Ansel Keys was like, it's the saturated fats. But why is saturated fats from, butters and steaks, why is it demonized to say that is what causes heart disease?
The reason is exactly kind of what you alluded to, is that the country wanted an answer, and Ansel Keys gave them an answer before that answer was well tested. And so by the time it was well tested, which even the studies that Ansel Keys did early on didn't show that saturated fat was causative in any disease. It actually showed that unsaturated fat, like margarine and things, was more causative. Before that research was done, they had already kind of ran with that theory. And, I guess there was some people who had a lot to gain from that theory as far as financially, certain food companies and things. And so that idea kind of stuck. and it kind of came ingrained in society, and it was in all the food pyramids and all these recommendations from academic institutions and government agencies. And so it's just been, it's almost been like we've been brainwashed that was the case. This is bad, but then when you actually look at the science, it doesn't support that at all. There are associational studies that show that maybe increase in saturated fat is also causes heart disease, but those are associational. Or increases in red meat can cause or are associated with heart disease. But those things you can't prove causation. And so it was kind of irresponsible of scientists and people making nutrition guidelines to take those studies and use them as to form their recommendations. But yeah, when you look at the science, there's lots of different angles you could take with this. If you look at the evolutionary approach to it, it makes no sense that a food like saturated fat or red meat that we've been eating for the entire time that humans have been on Earth is now causing a relatively new epidemic of heart disease, because heart disease has only increased in the amounts that it's been to the amount that it is now for the past, maybe like 80, 90 years, something like that, when we've really started to see the rise. But we've been eating saturated fat for, millions of years, if you look at the evolutionary perspective of it. So there's that. But then you look at the science, and like I said, those early studies that even Ansel Keys was doing didn't show that there was a correlation between higher rates of heart disease or mortality when people ate higher amounts of saturated fat. And then you can also look at the biochemistry of what happens when you burn saturated fat versus unsaturated fat. And it's clear in the biochemistry of the cell, like the Krebs cycle and the electron transport chain, like the things that happen when we start burning saturated fats that are saturated with hydrogens. It's very positive for our metabolism, and it creates a state of insulin sensitivity in the peripheral tissues, which is what we want. Whereas the opposite is true with polyunsaturated fat specifically. Not to say that we shouldn't eat polyunsaturated fat, because that's necessary for health, but it's just when we get the amounts, we get an imbalance and we start eating more polyunsaturated fats than saturated fats, like when the vegetable oil started coming into the diet, and saturated fat was demonized. That's when we get an issue. So yeah, it makes really no sense. Saturated fat is absolutely necessary for human health, and unfortunately, because of this message we've gotten, I think a lot of people's health has suffered.
Right. And it's interesting because I think probably now 5 years ago, the governmental, I forgot which governing body, but they removed the higher limits on cholesterol, right? So they used to say you can only have like one egg every so often. And now they removed that kind of guideline because there was no science backing up that having too much cholesterol is not good for us. But they never really kind of announced it. So people still kind of get scared of cholesterol when there is no guideline of upper limits. So let's talk a little bit about the cholesterol. So, given all of the science you just brought up, the comment I just said, why are they still pushing statins, right? It's the number one selling drug. Our brain is made of 60% cholesterol, yet they're pushing a drug that reduces that. And there are even studies where they show correlations, and I know it doesn't prove it, but there's correlations where men that are taking statins have more mental issues, depression, anger, violence. And you have to wonder, well, 60% of your brain is cholesterol. And if you're taking statins that remove cholesterol, is it impacting that at all? So what are your thoughts with this whole statins? Is it safe?
Yeah. Yeah. I'll start by saying that, people should talk to their physician. Like, don't not take statins or go off your statin because I say to, or anybody says to. Talk to your physician, but you bring information to your physician too. Because I do think that this is something that, as well versed as they're supposed to be in this topic, they may not know all the information, may not be exposed to it on a regular basis. But yeah, so first of all, I'll say that I think that it's incredibly short-sighted and myopic to look at one biomarker on a blood work panel or one biomarker at all and think that you could say that someone's at higher risk for something, because humans, the natural world, whatever you want to say, is incredibly complex, and I don't think we'll ever fully understand it, and I fully accept that. And I think that to think that, we can do some studies and find these biochemical pathways and affect these things with pharmaceuticals and think that we are kind of mastering human biology or physiology is kind of egotistical. And so I think I like to say that first, because then it gives people, kind of the background to think that, well, we need to look at this cholesterol panel in the context of everything else that's going on in this person's life, not just the rest of the blood work panel, but all, other biomarkers we could take, just the general health of the person, how happy they are and all kinds of stuff, because that's really the only way we're going to get the true assessment of their health. So, but if we want to talk about specifically cholesterol, when I look at a lipid panel, I'm looking at, more importantly than LDL or total cholesterol, I'm looking at triglycerides and HDL. I want to see that the ratio of those two is happy, so to speak, a good ratio. And so, actually overheard a vascular surgeon and a neurologist the other day discussing a stroke patient that they had, and they were saying that they were gonna put them on a statin, put them on blood pressure medications and blood thinners and things like that. And then one of them said, but his triglycerides were like over 1,000. And they're like, do you know how to treat that? I don't know how to treat that. And I was just like, oh no, like, you guys don't know how to treat that? Like, that's the number one thing we've got to treat for this guy, And so that's, to me, and they didn't know because they didn't have a drug for that. It's not their fault. That's just the way they're trained. And
Right.
then when they're trained that they didn't have a drug for that, they didn't know how to treat it. But yeah, so the triglycerides are really important. And the way we correct those is through diet and through creating metabolic health and insulin sensitivity. And that kind of stuff. That's what's going to help us get the triglycerides down. Yeah, so that's what I look for there. But then, if I want to assess someone for heart disease, it's more looking at insulin levels and inflammation and that kind of stuff. And we got to look at all that stuff in the context of an entire blood work panel, and also looking at heart rate variability and just all kinds of psychosocial factors and things in the person's life. That's going to be the full picture. And so, people listening to this, if your doctor takes blood work on you and says, oh, your LDL is high, you're at risk for heart disease, and wants to treat just that without telling you anything else about anything, then know that that's short-sighted, and there's more to the story there. And you need to inquire, look further, look deeper, to figure out what risk you actually do have.
Right. And I think the big thing with the cholesterol panel is knowing what diet you're on, right? So if your LDL is really high and you're on a meat-based diet and really no carbohydrates, then maybe that's not a concern, especially if your triglycerides are low. So you just talked about looking at kind of HDL and triglycerides, like what is a good ratio? And then if you could talk about like why is HDL good and why is LDL bad, and why do we want to keep triglycerides low? Like if you can, just educate us.
Well, supposedly, what we're told, like what I learned in school, is that LDL is more atherogenic, meaning that if there's lots of them around, then they tend to damage the lining of the artery and they get deposited there. But then, there's all these subfractions and whether or not it's LP little a or oxidized LDL, like there's all these characteristics of LDL we can assess for. And in my book, I discuss, something that happens in the body that I think makes it all sort of irrelevant. Not necessarily irrelevant, but less relevant, I guess I should say, than the emphasis that they put on it. But yeah, so LDL is supposedly more atherogenic. HDL is supposed to go around and clean up, more damaged particles, bring them back to the liver so that we don't get those. So it's good, right? But I don't necessarily think there's any such thing as good versus bad cholesterol. They're all just doing their job, and they all have different roles. But yeah, so even if you do take all those subfractions of LDL and you say that someone's got really small, dense particles, and they're more at risk, it's not because of the small, dense particles. It's because of what created the small, dense particles, which is the things we talked about already, the toxins, the stress, the endotoxins, all these things that cause inflammation and oxidative stress. Those are the things that are damaging the LDL. And it's like the LDL gets blamed because it's there, kind of framed a little bit. But really what's causing that damaged LDL is the same thing that's causing damage to the lining of an artery. And the LDL is just present because of what the body uses to almost like a spackle to kind of repair that damaged artery, So yeah, and then the whole other conversation is the statin one, and it's if we want to aggressively lower this LDL because it's supposedly so causative, but there are consequences to that, and the very consequences that we see tell us that okay, this LDL molecule is probably pretty important to the health of our body, right? Because if we start lowering it too aggressively, we start seeing people with cognitive issues. There's evidence that it causes insulin resistance because one of the steps into making cholesterol that gets blocked with the statin is a very important molecule that helps with insulin signaling, or with insulin receptors, sorry. And then there's it can deplete our amount of glutathione because there's a certain intermediate in the making of cholesterol that helps us make selenoproteins and make antioxidants, things like that. But then, like you said, with our cognition, our brain is made up of a lot of cholesterol. And if we're depriving the body of that, then we can have cognitive issues. There's sexual dysfunction because all of our sex hormones are made from cholesterol. So the very issues that we see with people who are on aggressive, cholesterol lowering medications tell us how important it is. And I think should make us question whether or not that's the correct approach, especially since that's been the approach for the last 60, 70 years at least, is to aggressively lower this number, and heart disease continues to rise.
Right.
People continue to die of heart attacks, and so obviously that's not doing the trick. We need to look elsewhere.
Yeah, no, that makes a lot of sense. So I'm going to ask you, so what's the ratio that you would say is ideal?
Oh, yeah. The trig to HDL ratio, so if you take triglycerides divided by HDL, you want to, I like it to see 1.5 or lower, at least. And so that's kind of what I use there. And then I also take fasting insulin and multiply that by the blood sugar, calculate the insulin resistance score. And I like that to be 1.5 or lower as well. Okay. Those are the two best markers, I think, of metabolic health and risk for heart disease. So we're using the cholesterol panel just in a very different way that a traditional cardiologist or medical practitioner would look at it.
So would you also consider ideally having triglycerides? And for the people listening, triglycerides are basically the floating fat in your blood, but would you also want that to be kind of under 100, or does it depend on the diet? Where do you stand with that?
I'd say definitely under 150, but yeah, under 100 is probably optimal. And the other thing is to make sure that you're fasting long enough before that blood test, because if you're not, or if you had some sort of digestive issue where it delays digestion or something, then that could, falsely elevate that number for you and make you think you're more at risk than you are.
Right.
I'd say at least 12 hours is what we want to be fasting, depending on the person.
Okay. With all these panels, do you also look at HSCRP, the inflammatory marker, the C-reactive protein? Okay.
Yeah. You can look at that, or GGT, which is a liver enzyme, can give us some indication of how stressed the liver is from oxidative stress and things. And there's lots of very little obscure and detailed level or biomarkers you could take, but that gets really expensive. HSCRP is a pretty good one to get kind of baseline inflammation.
Okay. Yeah. And for those listening, it's C-reactive protein. So what about, I've seen a lot of people with markers with high triglycerides, but I've also seen people with really low triglycerides. I haven't seen a ton of research on that where their triglycerides will be in their 30s. Is that dangerous? What are your thoughts with that? And they eat a meat-based diet.
Yeah. To me, with meat-based diet, that's pretty perplexing, because you'd think that, on that ketogenic type diet, your body's trying to give fatty acids and ketones and things. So there'd be more fatty acids in the blood to deliver those, that energy, So when they're low like that, to me, that could mean that the body's really good at using ketones. Okay. And doesn't need the amount of fatty acids there available to use those for burning energy for the cells. That's what it would mean to me, because the body's got to have some sort of fuel source. Or it could be that they're very metabolically healthy, and that the amount of fatty acids that are so when anybody, depending on their genetics, reaches their fat threshold, their because everybody's a little different, which is why some very skinny people could be, insulin resistant. And, someone who's overweight could still not be insulin resistant because they haven't met their fat threshold yet. But when you meet that, fatty acids kind of start spilling out of the fat cells into the bloodstream. And so that's, that when I think triglycerides, I'm thinking, free fatty acids, those types of things. That's what we're measuring. And so if someone has really low ones, then they're not anywhere near that fat threshold. And so I would say that they're really metabolically healthy. And ideally, if they're really low, the body's saying we don't need as much to deliver energy. So because we're probably using ketones a lot.
Yeah, and that makes sense. The person is pretty thin. That I think there was two of my clients that had really low, and they are very, very they're on the thinner side. They work out, so it makes a lot of sense with what you're saying. With the thoughts of like having once your kind of cells are done and they start spilling out into the blood, with that logic, do you feel that certain people maybe should not eat as much fat just genetically, or do you think it doesn't matter? And I'm only asking this because I do have clients that stop eating carbohydrates, and it's not that their triglycerides are really out of range, though. It'll be closer to 99, 100. That's good. I'd like to see it, no more than 100, especially on a carnivore diet, but they kind of slowly gain weight and they're not really eating carbohydrates, but they're eating a lot of fat. So I don't know if you have any thoughts on that. I know that's not really as related to heart disease, but.
Yeah. No, I mean, I think it's totally related to heart disease if we're talking about assessment for it. But in that case, if they're slowly putting on weight, it could be a situation where it is like a calorie issue, because in general, I'm not a fan of like calories in, calories out and that kind of stuff. But
calories matter though.
But yeah, they do. And so in people like this, that's one strategy, is to limit calories and go higher protein and see how that does for them. But the other aspect is that, I think that, we often think that not heart disease, but weight is all about the calories or diet, and it's not necessarily because, if you are in a high stress state, then your body is not thinking about losing weight. It's not thinking about metabolism in general. And so if you go on that carnivore diet, you're eating way more fat, and then you're also super stressed, then yeah, your body may be not metabolizing that fat the way it should be. And you end up storing some, right? Same thing with toxins. So like fat cells I kind of think of them as the body's like garbage can or waste. So if there's too much of something, it gets rid of it. If there's too many toxins, it stores it in fat cells. If there's too much energy, it stores it in fat cells. And so lots of times if we go on this diet that's pretty efficient at mobilizing fat, and we start doing that, toxins come out as well. And so if like say the liver is struggling or something, we haven't addressed that, or they are really stressed and they can't deal with those toxins, your body just halts weight loss, sometimes even makes it go backwards. It says, no, put this back in the cells, and you start gaining weight. And so there's all these different things that can play out, which is why it's not just about diet. Because I've had clients too and patients that they either stall or they go the opposite direction of what they want. And we have to say, okay, well, we've addressed the metabolic health. Now we've got to address the other things,
right?
Which is harder or easier said than done.
Yeah, no, totally. I mean, I think one thing is, we are living in a much more stressed state. I think we have notched up in stress and we consider this normal now. And I've been really sharing that we need to reduce our stress, because I'm seeing a lot of people heal their gut. Lots of, like you're saying, metabolic syndrome healed, all these things. And then there's like a little bit that they still need to heal. And it's maybe trauma from the past or just stressors that they have in their lives. And then a lot of the comments are, well, I can't change my job. Well, I can't do this. So I have to kind of live with that. But I see it affect people's health. And it's more than I think what people realize. I mean, one thing is that our bodies produce cortisol, which manages stress through fat, right? So I can see why our body will hold on to more, because it's a protective mechanism to hopefully even have more fuel to produce cortisol. But what are some ways that we can manage stress? Or, I mean, what have you seen with your clients that, had lots of stress, or their liver, their detox pathways weren't as healthy? Like, what were some kind of tips that you did to see finally maybe some weight loss happen, or just in general healing happen to the body?
Yeah. So to preface this, so when we think about stress, we're talking about the autonomic nervous system, which is the system in your body that's perceiving your environment through your senses, and then telling your body, are we in a safe or threatening situation? And then the body reacts accordingly. And so, this day and age, especially with humans and our big brains, we're like the only species that has the ability to literally think ourselves into a stress response. We don't have to have anything life-threatening happening to us. We could think our way into that situation. We could see somebody across the world have something stressful happen to them, and then fear it's going to happen to us, or have something stressful happen to us, and instead of getting over it with a day or two, we think about it for a month or a year. And so we can set ourselves up for these types of issues. And so if your body is chronically but incorrectly getting signals that you're in a life-threatening situation, then it's not thinking about things like digestion, or detoxification, or procreation, or sleeping, or anything like that, or even metabolism. It's not thinking about metabolizing anything. And so people who can be stuck in the stress state can see things like insomnia, or sexual dysfunction, or poor, slow metabolism, or digestive issues, that kind of stuff. And so it's really important that we learn how to, as best we can, mitigate these things. And again, it's easier said than done. This is the thing I struggle with the most. Admittedly, it's really hard to get a hold of this, but it's really important. And so I think that, there's all kinds of ways that, you can read articles all over the internet that say increase your parasympathetic nerve, or decrease your stress. And you get all the usual things like yoga and meditation and nature exposure and laughter and time with friends and all that kind of stuff. And all that stuff is really important. But I also think it's very important to identify what types of stress, especially personally to the individual, are causing the most damage. And so when you look at the research, there's a few studies I'll talk about. One is they looked at people in a work environment, a certain work environment, a certain company, and they found that the people who had the highest demand jobs, and were the most busy and had the most quote unquote stress, also had the lowest amount of health effects from the stress. However, they found that the people who had the amounts of stress that were types of stress that they couldn't control, so like job security, or how much they made, or things like that, things that were out of their control, that was the most stressful and had the most damage to, or caused the most damage to health. These people had the worst health outcomes. So being stressed and being busy is not necessarily detrimental if you thrive on that stress,
Right. Okay.
But if you feel like you're out of control, or if so, I think about the last year, and what's happened in the world and how people have felt out of control. It's no wonder that we're seeing, increased rates of, mental health disorders and things like that. Stress-induced cardiomyopathy, that kind of stuff is all increased because people have felt so out of control. Right. So it's important to realize that. So if you have stresses in your life that you feel like you can't control, or make you feel out of control, those stresses make you feel like you can't control or out of control, those are the ones you need to see if you can either change your perspective of or eliminate those stresses somehow. Sometimes you can't. But yeah, and then the other study is one along the same lines, where they interviewed people and they asked them how many stressful events they had in the past year, like major stressful events like loss of a loved one, various things like that, loss of a job, whatever. And they found that there was a direct correlation to how many stressful events people reported and their health outcomes, poor health outcomes, or even death in the future. But however, they also asked the people if they felt that stress was damaging to their health. And so whenever people reported that they didn't feel that stress was damaging to their health, the correlation went completely away, all the way down to zero.
Wow.
So it's interesting, and it's just associational studies, but it's interesting that it's almost like those people, had those stressful things happen to them, but they had control over it in their mind, and so it was the people that didn't have control over it that we saw the poor health outcomes with stress. So oftentimes it is our perception of the stress that's happening to us. And then the other advice I give is to do something like either neurofeedback, or tracking your heart rate variability, so that you can kind of get a sense of what things in your life are happening to you that are creating that stress, because your mind can override things. And I always give the example of like walking down the street in New York City, and there's just all of these noises, horns honking, and our minds can override that. But when our body hears those unnatural things, it has a stressful response to it, whether or not we react, with our mind. And so neurofeedback and heart rate variability can tell us or clue us into the things that are actually causing our physiology to have a stressful response. And again, it's likely to be those stresses that we feel like we can't control, or that make us feel like our life is out of control. But that can be very informative, because then you know which stresses to go and focus on, and try and mitigate or change your perspective of or something.
Yeah, that's pretty powerful. I mean, I always talk about lowering stress to my clients and I give them, options like, do breathing like right before you eat, because you need your gut, your digestive process to be in a parasympathetic state. You want to do breathing exercises to kind of force it. But if you think about the bigger picture, it makes so much sense that it's really the, imminent death that's going to happen to someone that's in the family that's has like cancer or something. Those are things that are out of our control. We can't time the death. We can't try to eradicate it. And so I think those stresses, and I see it in my clients, all of a sudden they regress in their health because they're all of a sudden taking care of somebody. But even in my corporate world, it makes so much sense, because a lot of my like directors and, the people that were really stressed afterward, they would, I guess, try to manage that stress by going out and drinking, or they were addicted to some other type of addiction. And it makes a lot of sense, because that's how they're just kind of dealing with it. But it's because they can't manage that stress. And a lot of them were, slowly overweight. They were just, having other health issues. And so it's interesting, when you feel like you're not in control, that's when things can spiral. And I see it in even the way that we have internal scripts, right? So when we have a stressor, how do we handle that stressor? And like you're saying, it goes back to what you're saying, that'll affect a lot of how we actually deal with that stress. And so it's fascinating. It's not the total stress you have, but the way you're dealing with it and the kinds that make you feel out of control. And that's a huge difference. It's pretty cool.
Yeah.
So, you mentioned there are also toxins in the environment, but we didn't talk about specific ones. Are there any ones that you're like, yeah, you got to stop doing that, right? So one, I interviewed Dr. J a long time ago, and he talks about lavender oil, essential oils being very estrogenic. We also talk about plastics. Is there some specifically that you have seen that's probably not ideal to have in your like daily life?
Yeah, I think that two that I'll highlight here. One is like a group of them, and that's the heavy metals. And so these are things like, or just, I guess, metals in general. They're not all heavy metals, but aluminum, mercury, cadmium, arsenic, lead, those types of things, which we find a lot in our environments these days. So you really have to kind of be diligent about finding out the sources of those things and limiting them when you can, but not freaking out and overstressing about the ones you can't control, right? Because there's nothing you can do about them. Just do the best you can about the other ones. And so, common sources of mercury are, the higher mercury fish, and so you can kind of look up which fish are higher in mercury and which aren't. Generally smaller fish are better, but salmon's also a good one. But there's mercury amalgams in people's mouths, which are still being put in, not as commonly as they were, but they are still allowed to be put in, which I think is crazy.
Oh, wow. I didn't know that. I thought they stopped it in the 90s or something. Oh, wow. I didn't know.
Yeah, I thought that too, but I learned that, at least from my most recent knowledge, that they are still allowed to be put in if that it's what the dentist wants to do. I don't know. But yeah, so there's that. There's, everything from, aluminum cans, aluminum foil, like all these things end up in our food or in our environments. Cadmium, mainly cigarette smoke. So if you're in a place, if you're smoking in general, but also if you're in a place where people smoke a lot, then you get exposed to cadmium. Arsenic can actually be quite high in things like rice. And so we just have to be conscious of these things and learn about where we're being exposed to them, and so that we can mitigate them. And then also make sure we're doing our best to help our body get rid of them as well. So making sure that we're doing things to help produce glutathione, which is going to help get rid of those. So like I automatically go to collagen protein. We want to be getting those amino acids to help us produce glutathione, but also cholesterol, the selenoproteins that help us do that. But also sweating, super important for getting rid of those things. And so there's heavy metals. And then the other one, I think that's incredibly scary is glyphosate, which is an herbicide made by which was Monsanto, now it's Bayer, that's sprayed on lots of crops. And even if they don't necessarily help the crop, like with wheat, they spray it on at the end to kind of dry it up and increase the yield and that kind of stuff. So, I guess it's hard to avoid because it's everywhere now. And like Dr. Stephanie Seneff's talked a lot about this. It's hard to avoid, but the best thing you can do is, eat organic, because then at least that, there's no GMO, so they can't spray glyphosate on that. Doesn't mean it's free of toxins.
Right.
It just means that it's probably less, and there's no GMO, no glyphosate. Doesn't mean that it wasn't, right next to a field that was sprayed with glyphosate. So it's hard to really know, but I do know that as far as ruminants go, they tend not to bioaccumulate this stuff
right.
in their tissues. So, if we want to eat a food that we can, guarantee is going to have less, if any, glyphosate, then a ruminant animal is probably one, because these glyphosate will affect them negatively, just like it will affect us negatively if we're exposed to it. However, it doesn't tend to bioaccumulate. So when we're eating that food, we know we're not getting this huge dose of glyphosate,
Right.
But it's concerning because, it's now in the fuel we use for our cars, because they put corn, ethanol, in the fuel. And so then, does that mean that it's coming out of our exhaust and it's all in the air? Like it's worrisome. And so the more that we vote to not have glyphosate by buying organic and avoiding it any way that we can, we're telling big companies we don't want it. We don't want their product if it has it in it. So those are two that are extremely damaging, heavy metals and glyphosate that can cause that oxidative stress and those toxins that we're talking about.
Yeah, it's really scary. I wrote a whole chapter on GMOs and glyphosate. I used to drive from Los Angeles to Berkeley, and there's this whole area that has just factory farming. And I used to think it was so bad because that's when I was plant-based. And I was like, look at the pollution, look at the smell in this area. And then as I did the research on GMOs, it's just so scary how prevalent, pervasive glyphosate is everywhere. I mean, we can even do our own by not buying Roundup, right? Spraying it on our yards. The half-life of glyphosate is like weeks. And so when your kids then stomp on the yards, they're breathing in Roundup, which is glyphosate. And it's so scary because it's everywhere. And it's in our waters. Like you said, it's probably coming out of our exhaust. And then people will say, well, your animals that you're eating that are not grass-fed, they're also eating a lot of that. But like you said, it doesn't accumulate. And that was one argument I made in the book, is that I think it's actually safer to eat, these farm factory animals versus eating like just standard GMO vegetables, because of what we're talking about. We don't have that kind of intermediary protection of like eating the animal that ate it, but not eating the direct plant that is so toxic to our health.
Definitely.
And I mean, it's not even correlation. There's proven studies where it causes cancer, and it's so scary. I mean, so what would you say is an ideal diet then for heart disease?
I think that it has to meet a few criteria. One, that it creates metabolic health, meaning, and I kind of describe that as your body's metabolizing your food in a way that doesn't harm you. And so it has to create that, which in general is a diet of whole foods. That's probably the best bet, the best like one line statement I could give to create metabolic health is whole foods. For some people, it's a little more difficult than that, but generally that's, yeah. And so, animal foods are probably the best whole foods that I know of, in my opinion, depending on the animal food, I guess. But so it has to be that. It has to be a diet that doesn't produce oxidative stress and inflammation. And so again, that goes to whole foods, because the processed foods are the ones that, like we talked about, create that excess free radicals, or the vegetable oils become damaged when they get in the body, and contribute to that oxidative stress. So again, it's the whole foods. And then also, we want to eat a diet that also creates balance in our autonomic nervous system. And it's not as strong for the other as it is for the other two, but there is some evidence that, the processed carbohydrates, the high sugars, the vegetable oils do, stimulate the sympathetic nervous system, causing or contributing to imbalance in that. And so that's kind of like my three-pronged approach to heart disease. And so anything that I do, whether it's diet or any kind of lifestyle thing, I want to make sure that it's assessing one or two or all of those imbalances, because those are the imbalances I think create all chronic disease, but specifically heart disease. And so there's actually one study that looked at, I think they gave people heavy cream as a drink, and they gave people like a fruit juice of some sort. And the people who had the fruit juice, the high fructose fruit juice, it stimulated their sympathetic nervous system way more than the heavy cream versus controls. So pretty interesting to see that kind of stuff. Doesn't mean that that's that alone is going to cause an imbalance in your autonomic nervous system, but it clearly has an effect.
Yeah, and it's amazing to me that there are diets out there now that's saying we need little bits of sugar to balance our cortisol, but that study alone is sharing, actually, it kind of causes more cortisol. So
yeah,
it's just wild. But one thing I want to bring up is, so you keep bringing up antioxidants. So we all think naturally antioxidants equals fruit, right? So can you talk about maybe how antioxidants, the best source isn't always getting it from fruits?
Yeah. I think that for me, the jury's out on this. Like, people are told, curcumin and fruits and all this kind of stuff that give you more antioxidants. And, from studies I've seen, there's definitely reason to call that into question. Not that they're antioxidants, but that they have any effect on our state of oxidative stress, because there's studies that show people who ate more of these antioxidant rich foods or took more of this supplement or whatever, it had no effect. And so when I think of, the burden of what we call oxidative stress, that's produced in a large part in the cell, mm-hmm. right? So it's, if we're burning the wrong fuels, if we have these very pro-inflammatory fuels like vegetable oils, polyunsaturated fats, and we're burning lots of those, and then we're making lots of oxidative stress or free radicals from those, then that's going to damage the cell, because it's all happening right there. Right. So in my head, I want to, instead of taking in these antioxidants externally that, like I said, may or may not be doing anything, I want to increase the production of the antioxidants that are made right there in my cells, so that when this happens in the cell, they're right there to take care of it. Right. And so that would be the endogenous antioxidants, the ones made in the cell, like glutathione, superoxide dismutase. And to me, those are things like creating some I would say some common sense or logical hormetic stresses, which gives a little bit of stress to your body so that it makes more glutathione in response. So that could be things like exercise or hot cold therapy or ketosis or whatever. So it's those types of things, but then also getting your body the right nutrients so that it can make those endogenous antioxidants. And so I kind of touched on those earlier. We want to have, plenty of cholesterol synthesis happening. We don't want to block that process with a statin because some of those intermediates are important for important components of making those antioxidants, the selenoproteins. But we also want to be giving the right amino acids. And so, which is why I think that things like collagen protein, connective tissue protein is important, because it has a slightly different amounts of certain amino acids. And those amino acids are what are kind of like the backbone for some of these antioxidants. And there's interesting studies that show that, the one I'm thinking of is in rats, not in humans, but when they gave them these connective tissue proteins, the glutathione went way up. And so I talk about those in my book, but yeah, so that's the kind of approach I want. Let's stimulate your body's ability to make these antioxidants, because they're going to be right there ready to help, rather than hoping that the ones we take internally, through diet or through supplements, which may or may not be doing anything, get there and actually have an effect.
Yeah, and it's fascinating because I can't remember off the top of my head, but glutathione is produced by 3 different amino acids. It's not from fruit, right? And
Mm.
I also remember learning that blueberries, I know they're known for their antioxidant benefits, but they're actually a toxin in our body, and then it stimulates glutathione to be produced because of
Right.
the toxin. So it's just funny that people think, oh no, blueberries are so good, they're antioxidants, but it's actually not. Let me shift gears a little bit, and then let's talk a little bit about, calcium buildup in the arteries. So if someone
Mm.
gets their calcium score and it shows like there's some buildup there, is there any way, I mean, obviously we can change our diet and help reduce that, reduce the stress, reduce the toxins. But if there was any prior, is there any way to remove some of that through all of these?
Yeah, I think so. Just, mainly from the fact that we see people who have CAC scores, which is a measure of calcified plaque in the arteries. We see that gets reduced.
Okay.
If they take it, years later after making lifestyle changes. There are cardiologists I've heard that say you can't reverse that, but
Okay.
I've seen it. I've seen people or had people tell me that was the case. So yeah, and so then you have to wonder like how they do that, And so the first line of defense, I think, is stop creating the inflammation and oxidative stress we've talked about that perpetuates and continues that damage to the lining of the artery that would then trigger the body to deposit the cholesterol on there that eventually gets calcified if it's been there long enough, because lots of calcium and other minerals get deposited there. But then also making sure we have enough nutrients and I would say enzymes to help break up some of that old atherosclerosis there. So the enzymes, I think of one called serrapeptase that's been shown to help, dissolve plaques and things like that. And then for nutrients, it's largely about vitamin K2, because vitamin K2, it's one of its jobs is to make sure that minerals end up where they're supposed to go.
Right.
And so that means into the bone, right? And so if we don't have enough K2, sometimes we can get minerals deposited in lots of different areas, and including arteries. But lots of things can calcify, that happens lots of places in the body. But yeah, we want that K2. And we want, and there's actually evidence to show that vitamin K2 can actually prevent the formation of atherosclerosis and calcium buildup to the GLA matrix protein and everything through stimulation of that. And so when we look at where we get K2, because people think, oh, I get vitamin K and kale, and that's usually K1, or it is K1, and K2 largely comes from animal foods. You can get it from like fermented soy, but who wants to eat that anyways? It probably tastes pretty bad. But yeah, so we're talking about things like egg yolks and bone marrow and liver and things like that. Like those are great sources of vitamin K2. And so when we look at what people have been told, which is those foods are evil, and they're going to cause heart disease, so people are not eating those foods as much. And then we see this, this explosion of atherosclerosis. Well, maybe it's because we have this widespread K2 deficiency within our society. So yeah, I think that it can definitely be reversed. It's just a matter of lowering that inflammation and then getting the right things in the body that can help it work through that and heal that artery.
What about the enzyme that you said, the serrapeptase? Is there any way that we can increase it? Is there foods that we can eat that will support that? Or is it just reducing the inflammation?
Yeah, so the first line is the reducing inflammation, and this enzyme is not necessarily in a food. It's kind of this is what I would use. It's kind of a response to the amount of atherosclerosis we see, and I use it to help break up clots and also or I guess the tendency to clot, but also old atherosclerosis. As your body's cleaning that up, it can help clear it out. And it's made from it's extracted from a silkworm. And so, yeah, so it's clearly something that I don't think that we need to get lots of, if we're healthy. but this is just, I use it in people who are struggling with that type of stuff, and we can use that to help them, along with all the other changes we want to make to get rid of that atherosclerosis, or encourage it to break down.
Yeah, and I think all of these are kind of benefits in the, I guess, intermediary, but they're really band-aids if you don't fix the inflammation, the lifestyle, the diet, the stress, etc.
Yeah.
Thoughts on salt and blood pressure? There's that whole thought where salt, well, I know it's managed by aldosterone, but salt will affect your blood pressure, higher blood pressure, risk of heart disease.
Yeah. Yeah. In my book, I have a whole chapter on high blood pressure, and I do talk about salt in it. But my main point, with all the explanation I go through in it, my main point is that I do not think that high blood pressure is causative in any of the issues that it's associated with, like higher heart attacks or strokes or whatever. I think that the same things that are causing high blood pressure are the things that are making those other things happen. So again, high blood pressure is just another result of the insulin resistance or the inflammation or the imbalance in our autonomic nervous system that's creating the high blood pressure. Yeah, then, you get the whole issue of how we've been told that salt causes high blood pressure. And the idea behind that is that, when your body wants to hold on to minerals, sodium, potassium, all kinds of different things, when it wants to do that, those minerals have to be dissolved in fluid. And so the body has to hold on to fluid, like in the kidneys. It has to kind of draw those minerals back in through holding on to fluid. And so the thought is that, the more fluid we're holding on to, the more pressure we're going to create in our blood, because there's more fluid there, and it's just more full, just like, more pressure in a hose or whatever. And so that's going to cause high blood pressure. But when you look at the studies, there's not many that really support that, as far as increased amounts of salt intake, and forcing the body to hold on to those things, hold on to those minerals, and increasing blood pressure. There's a lot of studies associated with insulin resistance and high blood pressure, which makes me want to think that's more the cause. But there's even one particular study that I can think of off the top of my head, where they gave these patients with heart failure, so who were, had heart failure, were accumulating fluid in various places in their body, edema type things, and they gave one of them just a diuretic, and they gave the other one a diuretic and a saline solution, and they were expecting that the saline solution would, negatively affect the diuretic, and they wouldn't lose as much fluid. However, the ones with the saline solution lost more fluid. And so to me, that means that, so since our body likes to hold on to minerals because it uses them for things, right, if we don't have enough minerals in our body, like we're not getting enough salt, your body's trying to hold on to more fluid because it's holding on to more minerals, right? Whereas if we provide the body with enough minerals through our diet, like sea salt and things like that, then the body's saying, oh, we're getting more of this, we're getting plenty of it, we can let go of the fluid, we can let go a little bit of minerals, right? And so we're able to get rid of some of that fluid as well. So it's kind of backwards from what we've been told. And that's just one study, doesn't prove it, but based on all the evidence with blood pressure and salt, it just doesn't make sense that salt would be that bad for us.
Yeah, it's interesting. It's very counterintuitive, where you're, kind of swelling, you might have inflammation, or it feels like inflammation, but it's really just maybe water retention. And some of my clients will try a little bit of the salt as counterintuitive, and then they'll feel better. So it's really interesting, and it makes sense of what you're saying. So why do people then feel like, because there are people in the meat-based community that feel like when they add salt, they just feel worse. And if we need salt, why do they feel that?
It's hard to say. I said that everybody's a little different, but it could be that, and this is where genetics, I think, does matter a little bit, because some people could just be really good at maintaining that electrolyte fluid balance. And so when they add more, their body's like, well, we've already got enough. And so maybe it makes them feel better, maybe it messes with that balance. Whereas other people, especially those with maybe poor kidney function, need to replace more of that salt that they're potentially losing through the poor kidney function, which could be just a genetic thing, or it could be that they've done damage to their kidneys, So yeah, it's definitely a trial and error thing, and I think that is really important to understand, is that these guidelines, these rules that we all set for everything could be slightly different for everybody individually, not because we're all completely different physiologically, because for the most part, I think that we all have the same kind of physiologic mechanisms, but we all experience different things throughout our lives. We're born, how we're raised, everything we encounter, and so has I think as much to do with who we become and how our physiology works as what the genes we're born with were.
Yeah, no, that's really powerful. So where can people find your book? I have it here. I haven't fully read it yet, but I mean, some of the questions I asked you were from the book, and it's pretty powerful. I'm, really looking forward to reading it. And there's even graphs and, explanations. It seems like it's a, pretty easy read to understand more of the heart and the complications around it. So where can people find it?
Right now, the only place is Amazon.
Okay.
And it's in paperback and in ebook. But I am in talks with publishers, so there may be a point where it's available other places. There may actually be a time where it's not available while I'm working with the publisher to get that back up and running. So if people go and look for it and it's not there, then that may be the case. But right now, yeah, Amazon is the place to find it. My website has links to that, which is resourceyourhealth.com, and people can find me in it there.
Okay. And are you planning on, and I'm only asking you because I got a ton of these questions myself, but are you planning on making an audiobook?
Yes. Well, if I go with the publisher, yes.
Oh, okay.
Because they're going to help me do that. Right. Whereas, if I stay self-published, then yeah, I'm going to look into that. But it's just it's a matter of how well the book does, I guess.
Yeah.
As to whether I put in the effort to do that. But yeah, so if thing goes well with the publisher and I sign up, then yeah, that's coming.
Okay. So, as we're wrapping up, what would you say are kind of the biggest points that you would say for heart health that you should do? Is it the diet? Is it the kind of managing of stress, the toxins? I mean, I know it's kind of a blend of everything, but what would be your simple tips for somebody to just get started?
Yeah, I think that, a lot of emphasis is put on diet because of, the association with cholesterol and all this kind of stuff, or I guess the attention that's drawn by cholesterol. But the more and more I look at things, the more I uncover, I think that imbalance in our autonomic nervous system, imbalance in our stress response is, I hesitate to say it, but I think the main driver of most of the issues we see with heart disease. And these other things, the oxidative stress and inflammation and the metabolic health and all that kind of stuff are definitely complicating factors for sure. But I think that, yeah, the more and more I uncover it, and it's also the most ignored, aspect of the heart, which I think is crazy to me, because we're the ones that say, I love you with all my heart, or I gave it all my heart. We're the ones who associate our emotional state, our stress response with the heart. We subconsciously do that. And the vagus nerve, which communicates the autonomic nervous system signal, is highly, the heart is highly innervated by that nerve. And most of the signals that the heart, most of the signals that are communicated between that go from the heart to the brain, not the other way around. And so it's clear that the brain is interpreting our emotional state, by how we're feeling through our heart, and so it's curious, but I think it's very, very important that we pay attention to that more, and through all the things that we talked about. Yeah.
Yeah, no, I think it's really good. I think it's very powerful. So thank you. So where can people find you other than the book, but are you social media?
Yeah. So my website is resourceyourhealth.com. And then I'm on social media. It's just Dr. Stephen Hussey, Dr. Stephen Hussey.
Okay. And I'll link to everything in the show notes. So thank you so much for joining me. This has been so good. And it just, to me personally, it just refines to me that we really, really need to manage stress and how it affects the autonomic nervous system. And that it's not just diet, right? It's holistic health. It's covering everything and making sure that, we're not just eating whole foods, but the plant foods of just GMO or something like that. So it's just the blend of everything. So thank you. And thank you just for joining me today.
Yeah, thanks for having me. It's been great.
Okay, guys, I hope that you enjoyed this interview. Dr. Stephen Hussey is just a great person. I hope that you read through the book and you learn a lot about heart health and what it all entails, and that diet is not the only thing that we need to work on to have better health. And it's just really about holistic health. It also includes gut health, removing toxins, eating animal-based proteins, and a bunch of other things. I hope that you have learned that, there's a lot of things we need to work on, but not get stressed about it and not try to live perfection to get to better health. There are just so many things, and we are sometimes looking so myopically into just diet or into just this or that. And we need to look at our health and our environment and our wellness in a holistic sense. Yeah, I hope you guys get the book. If you enjoy it, just tag me on social media and let me know if you enjoyed the book, and we'll make sure to share. All right, guys, you know the drill. Make sure to eat a lot of meat. Take care of your bodies, because it is the only place you have to live. And if you like this video or podcast, please make sure to share with somebody that needs to hear this about heart health. All right, guys, I'll talk to you next week. Take care. Bye.